Hey, welcome! It's Ashley from Demystifying Your Health. Today we're going to be looking at colic. Sure, babies cry a lot. However, usually once they've had a diaper change or are fed or burped or something along those lines, they calm down. What happens though if they don't? And no matter what you try, they're inconsolable. They might have colic. What causes it? How can you manage it? Is there a way to prevent it? Colic is when an infant has frequent, prolonged, intense crying that occurs for no apparent reason, and no amount of consoling comforts them. The exact cause is not known, but it's thought to be related to a digestive tract that's underdeveloped, food allergies or intolerances, overfeeding, underfeeding, or infrequent burping, an early form of childhood migraine, family stress or anxiety, or a mother who smoked during pregnancy or after delivery. It is not related to gender, preterm versus full term, or formula fed versus breastfed. An infant is considered to have colic if they cry for 3 or more hours a day, 3 or more days a week, for 3 or more weeks. It usually occurs more often in the evening time and will appear when a child's about 4 weeks old and last until they're about 3 to 4 months old. The crying can often seem like screaming or as if the child's in pain. This will lead to facial distortions and body tension. Infants with colic are usually fussy even when they're not crying. Colic can be very stressful for new parents. It often leads to increases in postpartum depression, early cessation of breastfeeding, feeling guilty, helpless, exhausted, or angry. It also can lead to shaken baby syndrome. This is when a parent or caregiver gets so frustrated by the baby crying and trying to comfort them that they actually shake the baby. This can lead to brain damage that causes permanent disability or even death. When it comes to treating colic, there are 2 main goals. The first is to soothe the infant as much as possible. The next is to provide the parents with as much support as they need. When it comes to soothing the infant, there are several things you can do. One is to use a pacifier. It's also a good idea to take them for a ride in a car or stroller, walking around with them or rocking them. Give them a warm bath or rub their stomach or back. Play soothing sounds or dimming the lights, anything that will help decrease the amount of stimulation. A huge factor is changing their feeding practices. This can include feeding them more upright, burping them more frequently, which means burping them during feeding and after feeding, using a curved bottle or one with a collapsible bag. All of these things help to reduce the chances of air getting into their stomach, which could make them irritable. Another factor is if you use formula, to try a different formula. Maybe it just doesn't agree with the infant. And if you're breastfeeding, maybe changing the mother's diet is helpful, because certain foods like cabbage or onions or common allergens can actually irritate an infant's stomach. When it comes to supporting parents, it's important to remember a couple of things. First, that it's okay to need a break. It can be very overwhelming and frustrating. If you're getting to the point where you're getting upset when your baby's crying, remember it's okay to put them in their crib for short periods of time. This will allow you the moment to collect yourself so you don't end up hurting them. Be sure to talk about what you're feeling with your family, friends, and your child's doctor. Don't try to go through it alone. Remember, you've got an incredible support system here, you just need to reach out. Be sure to take the time to eat healthy, make time for exercise, and sleep when your baby sleeps. You have to take care of yourself so that way you can take care of them. Have a plan in place so if you're feeling overwhelmed, you've got somebody to call who can come back you up. And remember, this phase is temporary, and it's not a reflection of any poor parenting or your baby rejecting you. Unfortunately, Because the exact cause of colic is unknown, there isn't a way to prevent it. However, you can prevent harming your baby by making sure you don't become exhausted and stressed out by following the tips we just mentioned. If you have any questions about what you could do to help alleviate your child's symptoms, be sure to talk to their doctor. Colic can be a frustrating and difficult experience for any new parent. Just remember, it's a temporary phase and you're not alone. You will get through this. Stay healthy.